and we are going live on Facebook right now, so your friends and others can see the webinar on Facebook Live. And also the webinar is being recorded, so we will upload the record of the meeting later on our website and on YouTube. I see most people are excited by now. Paradigm shift. Flying cactus? I don't know what does it mean. Eye opener? Who sent that? Fatem Provasam. Oh, she's from Iran too. I should see what does it mean. Eye opener, overwhelmed at times, but not too bad. That's the issue of and problem, problem of many students, healthcare workers, and even not healthcare workers. Many people in this situation, and it is important to understand that how we feel, and that's good that you say that your feeling is not a good feeling right now. These are really interesting, feelings, and by now I see that most feelings are, being excited, and I'm excited to have you here and being in this session. So I would like to talk a little more about the session that we have here. In the upcoming minutes, I would like to introduce Dr. Ostrander and Dr. Panda, our faculty moderators and our main speakers, and after that we will have our panelists from different regions of WHO regions, and we will have a discussion about how well-being is being worked all around the world, especially from the students' point of views. And please submit any question you have in the Q&A box, which is available on the bar below. You have a Q&A box there. If you have any, please write here. We will answer that after the panel or during that even. And all questions, I promise you all that all questions will be answered in this meeting. So I would like to introduce our moderators. I start with Dr. Mukta Panda, MD, MACP, Assistant Dean for Medical Student Education and Professor in the University of Tennessee Health Science Center and College of Medicine, Department of Medicine in Chattanooga. And she's also a fellow in the Royal College of Physicians in London. I'm sorry if I pronounce anything not correctly. And Dr. Panda, the floor is yours.
Thank you. Welcome, everybody. I will use the word excited also to be part of this special presentation. I want to thank the planners and organizers to get such an astute group together. I am just going to listen and learn, and hopefully my goal here is that this is a safe space We are all here because we have been equalized by something that has been unprecedented. And as we are living through this, our experiences matter. And each of you are with boots on the ground, and the future is in your hands. So what can we do to partner together to learn from each other? But before we can do that, we have to have voice and agency in a safe space. And our hope is that we provide that to you today. So welcome, and let's learn from each other and share with each other.
Thank you very much, Dr. Panda. Also, I would like to congratulate to you and your son, because I know that no one knows here today, and I think, if I'm not wrong, currently exact the time that we are in the meeting, it's the graduation ceremony of Dr. Panda's son, and it's a very great event, and I'm really happy for you and for your son, and I congratulate to you both.
Thank you, appreciate it.
You're welcome. Also, in this amazing webinar, we have another speaker, Dr. Noam Ostrander, PhD, LCSW, joined DePaul University's Department of Social Work as an assistant professor in 2006. He received his AM from the School of Social Service Administration at the University of Chicago and his PhD in Disability Studies at the University of Illinois at Chicago. It is my honor to invite Dr. Noam Ostrander to have the floor.
Hello, I want to echo what Dr. Panda said. I'm very excited about this panel, and I would add, not only are we hoping to create sort of a safe space, but I think also a brave space, right? Like it is, we're at a time where I don't think that there are really any experts. I think we're all trying to learn from each other and, pull on what we are experiencing and pull on what others have experienced and try and find sort of analogous experiences to this and find our way through. So, I'm hoping that we can sort of muddle through this together and do it sort of bravely and in a space without judgment. So I'm very much excited for this panel.
Thank you very much, Dr. Ostrander. I was telling my colleagues before the webinar that we students, we can do many things in the world, and we have a great potential and capability of doing many amazing things. But we should know that we cannot do anything unless we have the support of faculties, seniors, and experts in each field and topic. It is our honor to have Dr. Panda and Dr. Ostrander, our great experts in the well-being field, and it's amazing to have their support. I don't know how to express my feeling about having them here. Okay, I think we're a little late. I would like to invite Dr. Panda and Dr. Ostrander to take the floor and moderate the discussion among our great panelists. I also would like to ask our panelists that please introduce yourself, as the question will be asked from you. So I'm gonna turn off my microphone and I will enjoy this amazing discussion.
Hello, so I think that I've got the first question, and I think that it is that our respondents are Soham and Vaishi. And the question is, what psychological support and related services have been provided by universities towards students during the COVID-19 pandemic? And do you think that overseas students are at a greater risk? And I guess if I can add one more thing, if there are services that you haven't seen added, what might be needed? And I'll let whomever wants to go first on that one.
I'll let Vaishi go first, and then I'll take it from there.
Okay, of course, put in the hot spot. So everyone, my name is Vaishi Govind, or Vaishi for short. I am current sitting chair for InciSioN Grenada, which is a small island in the Caribbean. However, our school and our island has actually decided to repatriate many of the students in the area. So currently I am back home in California, so I'll be talking a little bit towards being an international student in a different country, as well as what is available here in the United States. So yeah, coming to our question about, what psychological services are available. I think one of the first things I want to talk about in terms of resources is that you can't address a problem until you can identify there's a problem. And what we see is during this time period, there's kind of like a negative cloud just kind of hanging over everyone. So it becomes a little challenging in recognizing that you actually have something going on, because you're in this environment where you're like, everybody's stressed out, everybody's upset. So am I really needing this kind of support, right? So some of the resources we have available, I can give you an example actually from our school, is that before this pandemic, we had an app known as SGU the Well. And basically in this app, it asks you a series of questions every morning, and you kind of go and input your answers, and you see like, oh, you know what? It looks like you're acting a little anxious today, or maybe you're a little bit stressed out. And it's kind of like a gauge for you to see where you're at. Now, this kind of app has been done at many schools of medicine, but it's not necessarily available to some of our undergraduates or, individuals who are in non-medical healthcare. To address this, there are some web-based solutions, such as through UCSF, which is University of California in San Francisco. They have a stress toolkit. In there is their own questionnaire where you can fill out to see whether you might be experiencing symptoms of stress or distress at this time. Aside from that, you also have these run-of-the-mill apps. There's a robot for it's actually CBT for anxiety and depression, but the biggest thing is that you kind of just need something you're checking in with to be a little bit of an eye-opener that something's going on and needs to be addressed. So that's a great app for that. There's also a lot of PTSD we're seeing at this time, and some people are not aware of, the symptoms around that. So there's a PTSD app available for free through the US government that you can use anywhere in the world, actually. And then aside from that, you even have your run-of-the-mill like sleep cycle app or period management app. And you're going to have to put in a little more effort in the sense that you actually have to go into those mood graphs and kind of be thinking to yourself, I haven't been very productive in the last 2 weeks. Where has my mood been at? Or where has my sleep been at? Or, what's going on with my cycle? And then you look through the graph and you go, man, I've been really upset for 2 weeks. This is probably why I'm not able to perform at my highest level. And so when we think about those resources, and then we can kind of set that gauge, next comes how do we address this issue, right? And there's a lot of psych services at school that are offering online Zoom counseling. And then there's also a lot of, student-based health insurances that are offering low or no copay telehealth, which you can access. But then comes this interesting little caveat, right? Because if you are an international student and you're not insurance providers, right? You can't really make use of the kind of systems they have in place just because your timing is so off. And so for these individuals, what do we do? Where do they go? They have to look for something in the community. They have to look for something nearby. Where are they really going to figure this out? One thing you can do is you can just Google any local university, any local hospital or healthcare, system that's nearby. That's something I could recommend. Otherwise, many of us on this call, in and off this panel, are part of a nonprofit organization that is behind www.students4, that's the number 4, covid.org. And there we have a wellness tab. There under that tab, you can see that there are some crisis hotlines linked, as well as some community resources linked. And they are linked by regions across the world. And they're all 24/7. So even if you have, something going on at a period of time that your provider might not be available, you can always go there and find some help. So I think when we talk about the breadth of resources, as Dr. Ostrander had asked, that might be a specific need in thinking about students who are not in your same time zone or in your same geographical space, maybe trying to come up with some sort of solution that they can best make use of in this time. Thank you.
Hi, my name is Soham. I'm from the European WHO region. I'm the InciSioN UK chair, and I'm one of the doctors. So I don't have first-hand experience of being a student, but obviously I work closely with students at Oxford University, and I can offer what support has been provided to them and what support they've asked for in terms of to the wider faculty members. So the lot of high-tech support was offered there from the American region. We haven't been as successful with our high-tech support, but I think we're doing quite well with some more low-tech and more support networks available. So my university has taken an approach of letting individuals within the medical school, as in to set up their own little groups. So they've delegated individuals to create a safe space, to create a place where they can send in their worries, and then someone can go to a registered counsellor who will take that into consideration and take down what support networks they can be pointed towards and send that back to them. They've also created a group where individuals can post, for example, if they've been affected with COVID, if they've had someone affected who's not themselves and they've had to self-isolate, and they're allowed to post on that, and other students in their surrounding area, because England isn't a big place and everyone can get to each other without too much difficulty. They've been traveling to bring their shopping, to bring food and anything else to that person, which has alleviated any psychological distress caused by their lockdown situation at that point in time. So really my university stressed on that community spirit that we all have. In addition to that, it's put doctors in charge of a group of students. These doctors are usually facilitators for other doctors within the NHS Trust, which is what the healthcare system is within the UK. So normally how it works is we have a faculty member who talks through the stresses that doctors have to deal with day to day, such as seeing end of life, dealing with difficult cases, etc., etc. And they've transferred these same facilitators over to medical students who may also be dealing with these difficult situations. And they've had those same discussions and same facilitations they normally would have with doctors with these students. And I think that's a really great tool and a really great thing that they've done. In addition to that, they have provided extra support in terms of regularly updating individuals. One of the things that was flagged up right at the beginning of the pandemic as something that was quite distressing for students is the uncertainty. And I think a way that a lot of medical schools are responding to that are by creating weekly newsletters, or in some cases across the country, daily newsletters, just to give an update. And it's surprisingly helpful. I've had a lot of feedback saying even a daily update where they've said nothing much has changed, everything is as before, was just so helpful, because it told them that the uncertainty wasn't just for them, it was something that was actually within the system. The system was hiding anything, that would have been clear and open. And I think the transparency has really helped. And I think these low-tech but really integral parts of psychological welfare, transparency, openness, community support have been really helpful. In terms of what international students have struggled with, and I think this is something that a lot of studies are also struggling to pick up, because as with COVID-19, a lot of studies have popped up looking to see how best we can support students. One thing that hasn't been considered is the impact of COVID-19 on different countries. For example, if you're a student from India or a student from China, you may rightly be more affected by the occurrences there than the occurrences in the UK. So if you're being asked questions such as, for example, has the lockdown easing up in the UK helped with your mental health? That might not be the best question for you. The question to ask is, has the lockdown in India or China affected your mental health? And I think those individuals are being slipped out of the net. And there needs to be a way to categorize what they're feeling due to the effects in their home countries, and a way to support them in the times when they can't even go back to their family. The only thing they can do really is to talk to them via Zoom, as we are doing now. I hope that helps. Thank you.
Wonderful. Thank you both for that. I'm going to turn it over to Dr. Panda for the next question.
Yeah, thank you so much. And I know we will unpack what you both shared, both from the student perspective and from somebody who you said is in charge and facilitating those discussions. I think some very key words were used, like awareness, community, transparency. Wonderful. This next question is for Aliyu and Vaishi again. And it was, do physical exercises help in achieving better psychosocial health during the pandemic? How can student organizations help in promoting it? And I just wanted to add the qualifier that if you have any experiences or in looking at this, you've had other modalities other than physical, please feel free to comment on that also if you're so called to. So thank you. Look forward to hearing from both of you, whoever will decide to go first.
Thank you very much for your question. My name is Aliyu Ndajiwo. I'm a medical doctor in Nigeria and also the chair for InciSioN Nigeria. Well, we all know how exercise is very important and how it's good for our body. You know, it's effective with dealing with many conditions: depression, anxiety, stress, PTSD. We know daily exercises, even if it's like walking for like an hour, it does a great deal in improving your mental health, and also even running. At this time, I feel the most common conditions that perhaps are affecting medical students, which I've met in my district hospital where I'm currently working, most of them will complain of anxiety. They have PTSD from. It's quite interesting. Like, some never forget the patients they've lost, like seeing in the hospital. Like, any death kind of stays in them as students earlier on in their career, and stress, and so much. And also medical students have had like relatives that were affected by the condition. You know, they also suffer from like the grief, for example. So I believe physical exercise has an important role to play in which, you know, in our brains, it helps release endorphins that make you feel good, make you feel sharper, make you sleep well, like regulate your system per se. And some exercises that could do all that, even with the social distancing measures currently, the lockdown, at least you could walk, you could run, you could swim in your backyard. I know hiking and perhaps skiing are out of the list, maybe due to the condition, but those are things they can do. And even in yoga, students could, you know, encourage other people or even themselves or others suffering from it to, you know, go into some activities. And one more like important thing I think that needs to be focused on: there are students that perhaps are like married, and, you know, the social distancing could lead to social isolation, and perhaps people that are in abusive homes. It's a very sensitive issue, but it's something that needs to be spoken about. That time that you spend more together could lead to, because of the stress and so much more, that could affect, you know, relationships and families in a way. And I still suggest, and I believe exercises, physical exercises, could also help a great deal by doing that. And the best way, or perhaps the easiest way students could help themselves and people suffering from similar conditions or situations, by educating and by advocating, via social platform or families. But they can educate and advocate within their families first, and, you know, from families the communities get to know, and, you know, they it spreads around. So the people on the best perhaps activities, physical activities that they could do, and that perhaps will help a lot with their mental well-being.
Thank you, Aliyu. Vaishi?
So when thinking about the different components of psychosocial health, and how we can address them. One of the things that like I typically do whenever I'm asked anything is try to go into literature or go, you know, online and see what people recommend, right? Because psychosocial health is actually a huge concept. It includes emotional health, social health, spiritual dimensions of health, right? And so how are we really going to address that? So I looked at, okay, well, what are people doing right now in industry? And I came across this doctor, Dr. Michael Emery is his name, and he is a assistant clinical medicine at Indiana University School of Medicine. And what he prescribes his patients is actually something he calls a magical pill. And he says this magical pill can improve nearly every aspect of your health and well-being. The magic part of it is that even if you take it in a smaller dose, it still has an effect. And when you ask him, okay, I want magic, what do I do to get it? How do I go about it? He tells you, I'm a sports cardiologist. This magical pill is nothing but physical exercise. And I thought that was a very interesting way of him putting that information because, you know, everyone wants a quick answer, but he kind of emphasizes that you can address everything by, you know, sticking to physical exercise. And even if all you're doing is about a 10-minute YouTube video, you can still have an effect overall on your health, right? And if you really want to think about the benefits of exercise, I think Dr. Aliyu told us about a lot of them. Another thing you can do is you can go into PubMed and just search the benefits of exercise, and you'll get 1,001 reasons as to why exercise is good for you, right? You still don't believe that? All right, go back into PubMed and type in physical inactivity, and you will find that it is actually one of the major risk serious diseases, including coronary artery disease, lipid dysfunction, and as Dr. Aliyu pointed out, a lot of mental health disorders. So now that we know all of this, you know, and we are being taught in industry that this is kind of what we should be telling people, I thought, okay, well, here's the issue. We're at a time where compliance is kind of a little bit of a problem because of, you know, the nature of what's going on. So what do they historically say when it comes to being compliant to an exercise protocol, right? And what do they tell you? Join a gym, get a accountability buddy, you know, get a trainer, join a workout class you like, et cetera, et cetera. And I really thought about that. And I was like, you know what this actually really boils down to? And I think Soham actually touched this on our previous question, was that we try to create a sense of community around exercise to make sure that individuals are compliant. And so that's where problem in COVID, because how do you promote community in the time of social distancing, right? It seems almost counterintuitive in some sense. So when I was thinking about that, I was thinking that maybe what we need to do is we need to look at our student orgs and what they do to continue to promote community, even when they are, you know, spread out all over the place. And so what they are doing is they're doing these Zoom meetings, they're doing these check-ins, and they're trying to be leaders. But a great thing they're doing is they're not leading such that I lead, you follow, but they're leading in the sense of I'm a participant in this community. This is how I address these issues in my life, right? And when they say that, they promote discussion, they promote involvement, they show their sense of belonging. I think that's one of the ways that we can kind of address ensuring that we take care of our health, not just in a physical way, but also all of these other components by bringing a sense of community, even in this time where community is kind of a difficult concept and a, you know, moving target. And in doing so, we encourage others by showing how we are doing this in our lives ourselves.
Thank you. Thank you. I think we definitely will unpack the topics of community and role modeling as we have the discussion. So thank you for that. I'm going to pass it on to Noam now for the next question. Thank you.
Dr. Ostrander, please accept my
Sorry, yes.
I would like to say something to our guest attendees. I see that our attendees are submitting questions in the chat room, and they also do not choose the option of all attendees and panelists. When you want to send a message in the chat room, please choose the drop box. And from that, you must choose the all attendees and panelists that, to your message be seen by everyone. And also there's another point, please ask your questions in Q&A box, because I'm afraid if you ask your questions in the chat room, it would be missed because we have lots of, chat sometimes, and in the Q&A box that won't be missed. I'm so sorry for interrupting you. The floor is yours.
Thanks. I just wanted to say I thought those were two great answers, and I think just for a second I'll note certainly we have a ton of knowledge about sort of the way that sort of mental health issues and trauma lives in the body, right? So like Bessel van der Kolk, who wrote The Body Keeps the Score, and sort of the whole neurobiology movement is very good on that, and sort of generative somatic. So, absolutely, whether it's, stretching or going for a walk or some type of physical activity is absolutely beneficial, and sort of being in your body and knowing that you are in your body and feeling those feelings. So I'm now going to turn back to Aliyu and Grace with the question of, so we know certainly that there's a lot of need for healthcare workers, but is the well-being of non-healthcare students at a greater risk? Has the COVID-19 pandemic changed their job prospects and their expectations for the future?
Oh, cool. Grace, take the question first, please.
All right, I'll take the question. So I'll start by answering the first part, which is the well-being of non-health students at greater risk? Well, it may not be at the same risk as the medical people or healthcare students, but they are also at risk. Then going to the second part, which says, has this COVID-19 pandemic changed their job prospects and expectations? Well, it certainly has, because right now, if someone was in their final year and was thinking of applying for a job, they may not get hired because we go back to the economy. There's a procrastination that the economy is going to shrink. It's already being seen in some parts of the world. So I do not think that employers will be very eager to hire new workers. Actually, in other countries, for example, South Africa, they're actually not rehiring expatriates. They're now considering their own people first. Then at the same time, there's some jobs which were now mundane. So they're like getting one person to do a job for 5 people. So that puts the non-healthcare students at risk of not getting jobs. And also, then the other thing is we also see that even the people already employed, they're getting sacked, they're getting out, they're being retrenched because of this COVID. And some people are actually not getting full salaries because of COVID. So this COVID-19 pandemic has changed their job prospects and expectations. And now most people are looking into gaining more skills, maybe skills which make it better for them to do jobs at home if you're not skilled in that. So I would advise them to look into getting more skills. You can take it from here.
Right. Yeah, for the first question, I don't think non-healthcare workers are more affected in a way, because medical students, especially in developing countries, are also assisting like the doctors and other healthcare workers in the hospital to cater and work with the COVID patient, like frontline workers. So they are at a higher risk per se. And also the job prospects for non-healthcare students or recent graduates, perhaps. It's quite, I would say, there's some jobs just like Grace mentioned earlier, in Nigeria, for example, most of the work now, like only few people get to do. There are a lot of jobs have been removed from some companies. People don't have jobs, and also one work could be made, like what 5 people would do before, one person is going to do it now. People and non-healthcare students perhaps might be thinking of ways to, you know, add more skills to their profession if they choose to continue, but they know now that the digital world kind of has taken over. The pandemic has opened the eye of people in a way that perhaps there are ways you could work at home that will be of more benefit to what you're currently doing, or whatever job prospect you might have, you will also add a perspective of having, in case of another pandemic, in case of something like this, let me acquire some necessary skills to be able to fend for myself and for my families, and, you know, support the whole community. So it's a bit dicey question, but like I said, at first, medical students or healthcare workers are at greater risk, and the job prospects, definitely, the COVID has disrupted many things, and many people, or most people, would consider their future careers. And I think the key will be for most is to learn from this and to know, oh yeah, let me acquire some skills that could help me in cases of similar situations to earn more, or to be able to sustain myself, or like the person or his family. I think that's what I can say about that regarding our environment.
Thank you, both of you. It's certainly going to be, you know, a process of waiting to see what the world looks like as we sort of reopen and recover from this pandemic. I'll turn the over to Dr. Panda for the final question.
Yeah, thank you. Thank you for all the insightful sort of questions and the really various perspectives that have a lot of meaning in the answers. So the next question is regarding the final year medical students. And it says, do the final year medical students feel overwhelmed by the urgency to gain professional responsibilities in and during this COVID-19 pandemic? Are they adapted in the healthcare system or not? And I think this would be, the responders would be Grace and Soham again. Whoever would like to go first.
I'll try and set a more joyous tone. I think from the last 2 answers, there's obviously a very somber message for non-healthcare workers. So let's focus on the positives for final year students, I guess. Number one, they've got a job, which is amazing. There are very few professions that are coming out of this COVID-19 pandemic with a job. Final year medical students will be, and that is something that I think a lot of people do appreciate. And for some countries, my UK included, a lot of these final year medical students have already graduated, and they're working and they're getting an income. This is something else that a lot of individuals across the world are not getting. They're not getting that income. They're not getting what they need to support themselves. But final year medical students will be getting that. They'll be getting the support they need as well, as me and Vaishi said right at the start. There's a lot of positives for final year medical students, but now let me answer the actual question posed to me. So in terms of how will final year medical students feel overwhelmed, I think there is a lot of focus on final year medical students being ready for practice to become a doctor maybe 3-4 months in advance. And this might mean that a lot of them don't have the clinical training they expected to get. This might mean a lot of them don't go through the exams and the rigorous revision that they expected to go through before they actually start training. However, you've got to realize that no one would actually let these medical students be on the wards, be doctors, unless they felt confident they had met the competencies. While they might feel unconfident about themselves, there's no one who's going to let you treat a patient unless they're fully confident in you. And their backing really does mean something. It means that they trust you. They trust a human life in your hands. And I think that adds a lot of value in itself, just their own backing towards you. In terms of the second part of the question, as to what things need to be done, what things could be done going forward, I think a lot of preparation needs to go in hand to prepare these final year students for actually taking up long-term job roles and their future profession as well. Because without these 4 months that they've gone through, they might have missed out on placements. For example, neurosurgeons amongst prospective filers may have missed out on a neurosurgery elective. They might have missed out on a neurosurgery placement. They might have missed out on a pediatric placement, whatever really that they wanted to do so. And they need to get that time back somehow. If it's within their training program or if it's within their leave, there needs to be something that's designated that allows these individuals to trial out the professions that they wanted to try to within these few months, so that they know what their future career trajectory pathways could really be. I think that's all I really have to add from my end. Grace, I'll pass it over to you.
Okay, thank you. Yeah, you're right. Medical students and healthcare workers, some are the safest workers for the time being in terms of income. Then to answer those questions, the first part, which says, do the final year medical students feel overwhelmed by the urgency to gain professional responsibilities in the COVID-19 pandemic? So firstly, I'll just say this is a very scary time for every medical student. Well, initially, you're very eager to start work, to get your hands dirty, I guess. But at the same time, medical students are very anxious to be doctors. Right now, they're quite excited though. They're very excited. They could be not excited, but they're anxious to actually help out and to make their mark. So because they know from their Hippocrates oath and everything they've been taught about ethics, this is humanity's greatest call to action in terms of healthcare. So most of them really want to come out and help. And also the problem comes in, they're anxious about PPE. Do our hospitals have PPE for everyone, for the new doctors to come in, for the medical students doing their final rotations? And also, they may be very concerned with their education. Was it quality education they got, since most of them had to come and practice when they still had 4 months to go? But then we go to the second part, which I think can answer the education part, right, which says, are they really adapted for it? So I believe that medical training, as we know it, locally or internationally, it's meant to be adaptable in any setting. So what they have learned so far, we all know that most of what you learn in medical school, you actually get to practice it when you're an intern. And I would want to encourage medical students that even if you finish a bit earlier than you expected, you're going to go and work, but you're going to be under supervision, you're going to be observed. So they should not worry much about it. And there's always someone to ask. They should not shy from asking for help because everyone expects them not to know. So I think they can adapt. And also, I also believe that true training comes when you start internship. Most of what we learned was theoretical. Most students actually didn't attend somewhat rounds. They focused on the theory. So they should always remember that they're not thrown into the deep end, but they'll always be under guidance. So they'll be helped to acclimatize to every situation. They just need to be protected and also be preserved in this pandemic. Yeah, that's all.
Thank you for those insights. And gosh, there's so many wonderful nuggets that you all have lifted up. And I think there are 3 questions, at least in the Q&A and some in the chat box. So before we move forward, I'm going to pass it back to Ahmadreza to how do you want to do the Q&As, and maybe we can take the few questions.
Thank you very much, Dr. Panda. Thank you very much, Dr. Ostrander. Thank you all great panelists. That was a very interesting and amazing discussion. And for me, it's a very incredible experience to hear stories from different regions of world. Sometimes especially we students, the students who are young and we've not seen, many countries. We think that, okay, our country is the most problematic country in the world, and we do not see that, okay, our other countries, what they're doing, or what advantages or disadvantages, what improvements or problems they have. And this is very interesting for me to hear all the stories from you. Also, I would like to ask our attendees to fill out the form that our lovely colleagues, Sponia and Lucas, have sent into the chat box. This is a form for feedbacks and evaluation. And as you know, I don't know if you know or not, we didn't say it before, I should say it right now. We provide certificates for our attendees, so please fill out the form to have your email and information to provide the certificate for you. And I would like to thank, before going to Q&A part, because I'm afraid that we do not have enough time for acknowledging our great colleagues. I would like to thank Mekina Haq and Lucas, and if I'm not wrong in pronouncing the name, I'm very bad in pronouncing name, Despoina, our great colleagues who have arranged and organized this session. Mekina is the coordinator of webinar team, and Lucas and Despoina are in charge for this specific meeting. I would like to thank them for their great work. And for the Q&A part, we have 3 questions. I would like to ask the first question from all our panelists, including Dr. Mukta and Dr. Ostrander. I think it would be great if we have the panelists' opinion and opinions of Dr. Panda or Dr. Ostrander on our panelists' opinion. The first question is written, hi there, I'm at medical school in England and I'm intercalating. My university hasn't released a policy about how marking of my dissertation will change in light of coronavirus events. I have seen other universities release safety net policies for students, and I'm feeling really unsupported and it's making me feel low. I'm wondering what to do and would appreciate any advice. So if anyone had any previous and similar experience among our dear panelists, please do not hesitate to share your experience. And also it would be great to have Dr. Ostrander and Dr. Panda's advice.
I'll weigh in for a second. I think, so one of the reasons that sort of we're seeing a lot of depression and a lot of return of symptoms of post-traumatic stress disorder and anxiety is that this is such an unpredictable time, right? Like, we don't know when it's going to end. We don't know sort of how to make plans. It's hard to have things to look forward to. And with that, I think the advice is almost always focus on the things that you can control, and worry less, or try to worry less about the things that are out of your hands. In some ways that also means sort of shrinking your horizon, your time horizon that you're looking at. So like some people, like in March, I was very excited because I had a data collection trip to Mexico City that I was going to do in April, and that was fantastic, and I was really looking forward to that. And then of course everything shut down. And I think trying to have those sort of more long distance plans, time-wise, it's just very tough. So like focus more on like, what can you do today? What can you do this weekend? But I wouldn't try to sort of forecast or broadcast out farther than that. But by and large, focus on the things you can control sort of in the interim.
I would echo that. And in the interest of time, I think really what we are called to do at this point is to redirect and reaffirm what we can, rather than retreat back and really not do the things. So a lot of times, like Dr. Ostrander said, that, we have short horizons and redirect and remember that there are many people in your situation, and the leadership are also looking at what flexibilities they can accommodate. So I think that can give you some comfort that asking for what are the opportunities, and there is so much flexibility. I'm not sure about England, and I'm sure Soham and you can have a conversation offline, but I know in the American medical system, the AAMC has really, for example, stopped for 12 to 18 months the CS exam. So they are making some major decisions like that because they understand the uncertainties and the anxieties for the students.
If I can go ahead and add one quick thing. So you might see in a lot of social media right now that a lot of people talk about pandemics and then they kind of, give some advice based off of that. And there's this idea that has been floating around in at least academic circles that Shakespeare wrote King's Lear during the bubonic plague. Happens is you see a lot of academics, and be them either students or even the assistant professors or individuals going after grants and things like that, and they're like, oh, this is my time, I'm going to submit like 5,000 grants, I'm going to come out of this flying, etc., etc. But what they're seeing is that it's actually really difficult to focus on reading during this time. It's really difficult to really, be productive. I think someone even put that up, right, as one of their words for the COVID pandemic was that they're feeling unproductive. So I came across this article. I'm going to go ahead and throw it in the chat box so you guys can read it and kind of, digest it yourselves. And so I don't take too much time, but I want to just highlight one little part of it in which there is a professor of science fiction studies at Georgia Institute of Technology. Her name is Lisa Yazek, and she leaves a comment which they actually quoted in this article. I absolutely love it, and I really want you. Says it takes a lot of energy to live through history. So just let that sink in a little bit. Maybe not right now, maybe meditate on it later, but whenever you're feeling discouraged, come back to that. It takes a lot of energy to live through history. Okay, so article right now, and go ahead and look at it when you.
Thank you very much for your great answers, and that was really great to hear those incredible and heartwarming advice. We have several questions, including in the Zoom account and from behind the scenes from Facebook and other platforms. And there is a question which is not in the Q&A of Zoom. I am going to read it loudly. There has been a lot of grief experienced by both families and healthcare providers. The grief processes are also disrupted due to quarantine and extensive work hours. What are some resources available for that? And how should we all deal with the process of grief in this new setting?
I can go ahead and start with that. I think, thank you for that question. You're absolutely right. And there's a beautiful Harvard Review article that talks about the discomfort that you're feeling is grief. And it talks about the 6th stage of grief, which after you go from the full anger, denial, so on and so forth, to the last stage, which is making meaning of that. And that is really something we have to turn to, is to find meaning in what we are going through. And you all started with that. We have to create awareness first. So we talked about this post-traumatic stress. How do we now reframe and go to post-traumatic growth? Right? And I know Dr. Ostrander is really the expert in that compared to me, but I'm going to leave you all with a few thoughts to think about. You all have already started this post-traumatic growth. You all have already given meaning to what you are going through by gathering here together. For the panelists for speaking, for the attendees for wanting to be part and have voice and agency. You have created what is called a community. You said that word, community. And what is community? It is nothing but a common unity, right? Think about it. Community is nothing but a common unity around a shared vision. You have the shared vision. So think about it. What you're feeling is this grief. Go through those stages, but always reconnect to that meaning. What brought you to this vocation to the first place? who is my community that I can connect with? That connection is so important. So if you think about a community requires communication. So please communicate with the people of whom you feel so you can get support from. Collaborate with them. Commit to something that you are going to do each day that makes you happy, that gives you meaning. Do that commitment each day. And then collaborate also with those Maslow's hierarchy of needs, those basic things, right? Take care of yourself, connect with your families, contribute to it. Giving, right? Offering your help, being part of something bigger always helps us. And meet those challenges with whatever competencies you can develop. And then you will have the courage. You have that courage, and resiliency is nothing else but to adapt, improvise, and overcome. So you're going to do that with courage in that community. So please lean on to those communities. I'm going to go ahead and also tell you that self-care is most important at this point. We take the Hippocratic Oath, and you alluded to that, which is timeless. But our healthcare system today, our pandemic calls us to the new oath of self-care and well-being in addition to the Hippocratic Oath. So give yourself that permission, and please do that. And I'm going to lastly leave with what you all talked about, how privileged we are. Never forget that. Think about it. In healthcare or any vocation that you do with meaning and purpose, which helps you overcome your grief, you have security. In healthcare, I think Soham said financial security, job security, right? We have that. We have psychological security because we are doing what we are passionate about. Plus, we have the unique opportunity to intentionally make a difference in somebody's life. And that is what gives us meaning. And I think that is something that if we can think about, even if it is nothing but connected, just that little attitude of gratitude will help us. With that, I think I'll pass it on to the panelists, Dr. Ostrander, in the interest of time.
I think that was so well said. I don't even want to touch it. You did a great job with that.
Thank you, Dr. Panda. Thank you, Dr. Ostrander. Our panelists, do you have any idea and similar experience regarding this, global issue? Thank you very much. So we're going to the next question. We have another question here. It may be a little, advanced and very special question. We should, I think, ask our experts specifically, because the question is, what do you think of neurofeedback as a post-COVID treatment for mental health? I honestly do not have any idea about neurofeedback indications and how and when we can use this in a treatment. So I'd like to ask Dr. Panda and Dr. Ostrander to explain a little and teach us. Here is a class. Here is a class, and we're here to learn from you. Please.
Do you want to start first, Dr. Panda?
I'm going to defer to you as you are the expert here, and I will tell you my practical experience. I am an internist, and I will have to tell you just how I think it works, not how I know it works.
Just before Dr. Ostrander, I'm sorry, pardon me, please. I would like to say again, our dear attendees and participants, when you put a message in the chat room, you should choose all panelists and attendees option to have your message be sent to everyone. Now I see that everyone is sending messages, but all messages are all messages are coming for us, for the panelists, and other attendees cannot see the messages. I'm sorry for interrupting you, Dr. Ostrander. You're here. Here you are.
Yeah. No, unfortunately, I was already trying to push it off. It's not necessarily my area. I do a lot in terms of mindfulness and meditation, but depending on the kind of neurofeedback, because I know that there are certainly versions of it that are more, use more sort of electrical means, that I may not be the best to answer it. And so one of my ethical obligations is to not speak on things that I'm not an expert. So I'll push it to Dr. Panda based on your personal experiences.
Yeah, sure. And again, part of being in a safe space is showing your vulnerability. And my vulnerability is that I have very limited experience on this. I know that it has been used for ADHD and things like PTSD. And that is purely from reading few informational items about the veterans and their work on PTSD and ADHD in children. I do not know more, but if we have to pursue this, I will be happy to do research and let the organizers know more about it. And whoever asks that question, connect with them and give them the information, or connect them to resources that will be better experts at it than mine. I will tell you that for general internists like me, I would refer this to a specialist for neurobiofeedback. I wouldn't try to do anything around it myself.
Thank you, Dr. Panda. Thank you, Dr. Ostrander. Very interesting points about neurofeedbacks. To be honest, I've not passed the rotation of psychiatric. That's why that I do not have any idea about neurofeedbacks, but I hope that I learn a lot about this kind of treatment in the future, because I know that people are asking regarding this treatment a lot, and I think people think that it's a very new treatment and the solution for every kind of problem. I do not have any idea, but we should learn. Going to the next question, all these questions were asked anonymously until now. The question that I'm going to ask is asked by Khair Ol Baraya. I hope that I pronounced your name correctly. Thank you for this question and the amazing answers. I really relate to that and appreciate it. As a final year medical student, I would also like to ask the panel about how the medical curriculum can be amended to include training to work any future pandemics, if any, like wearing PPEs and etc. Before asking our panelists, I would like to say that we will have a panel regarding medical education and curriculum during this pandemic next week. So I'm inviting everyone for the panel next week about the medical education. I'm absolutely sure that the next panel will be as amazing as this panel, and that's it. I'm going to invite our panelists to answer and share their experience regarding this question.
So I think a good way to first relate to this question has been the historic struggle of getting global health and global surgery to be really prominent as a topic in these medical schools. One way in which we could address it, given the curriculum pressures that medical schools already face, is in traditional settings in which PPE and hand hygiene is already practiced. During your surgical rotations, I'm sure in whichever medical school you go to, you're taught how to properly wash your hands, you're taught how to properly put on gowns and gloves. And I think there isn't much of a step up into just putting PPE into that little segment. It'd be another 5-10 minutes. And it would be an easy way to incorporate that into medical schools without adding to the burden of course content that they have to cover on a day-to-day basis. But obviously this will be something that medical schools have to look at a case-by-case basis. And I think while the argument is stronger for global health and global surgery, I know a lot of medical schools are still opposed to having an overemphasis of these kind of situations within them. And I think it requires a global movement like InciSioN's just to show them that this is something that should be taken seriously and that this is something that should be incorporated into medical schools. So the more voices ask for it, the more likely we are to actually get something like it.
And if I can add, in terms of resources, okay, there's a bunch of student groups at universities and hospitals and whatnot. And basically, they have been creating these kind of toolkits of the things that they're learning. Go online and find a bunch of them. Osmosis has its own toolkit. It has a series of videos you can learn through that. There's some of these free medical websites. They're not coming to mind, sorry. But another place you can look, which I know I mentioned before, I'm just gonna kind of backtrack a little bit, is again, the Students for COVID website. So a lot of the people that are working on this are not necessarily just students, but also some of the frontline healthcare providers and practice surgeons and physicians like in industry. So they kind of get circulated in some of these documentations on how to address certain issues. Like there's documentation on you go into one specialty and a pandemic come up and you have to switch to another specialty. What do you do to ramp up? How do you teach yourself kind of how to do that? And so a lot of this information is linked. If you're specifically a student on that website, if you look at the students drop down, we have some curriculum, which was a toolkit put together by a wonderful group of Harvard medical students. That's an excellent curriculum to look into. There are some Johns Hopkins, the Coursera, and some other curriculums listed there out of London as well. Otherwise, if you're looking more of actually, you know, looking frontline clinical guidance, then under the healthcare providers tab, there is a clinical guidance section, and there pretty much anything that hospitals are throwing out to, you know, help frontline workers right now, or help, you know, residents get up to speed and stuff like that, that's all available there. So if you're looking forward, you can go ahead and look at those resources and kind of always remember, in these situations, the biggest thing is thinking creatively. And, you know, the thing about like InciSioN is we have some third world countries here who always have to right source with how they're going to address issues, allocation, stuff like that. So just even as you're reading this now, think future, think creatively, think, okay, how can I apply this in some ways? You know, how would I apply this if I was in this country or that? And then you can kind of, you know, rely on your own understanding, rely on your own experience, rely on your own education to kind of lead you to the way that you need to be to these answers.
Yeah, thank you for that. I'm just going to tag on a little bit onto that. I think definitely there is an abundance and a burgeoning of resources that are available. I think what the nuggets that Vaishi spoke about was to use creativity and know yourself, because you can get inundated with those resources, which can in itself be a source of anxiety, right? So you want to really make sure which ones and be discernment, you know, of what do I need now? You're never going to know it all. You shouldn't know it all. We are all lifelong learners. We are all here to learn. The other thing I want you to remember is you are living these experiences. Your narrative is your narrative, and your narrative is valuable. Remember those narratives, right? You have all talked about the two aspects. One is the educational aspect of post-traumatic growth, right? What do I need to be competent to do my job? But you cannot be competent to do your job until you have your post-traumatic self-courage growth. And one way to develop that growth is through your narrative and remember, your stories matter. Your stories resonate with other people, and your stories are important to create that new normal, what we are talking about, right? So that new normal has to be better than what it was. Nobody wants to go back to the old normal. I've heard in London more than 90 people, or in England, don't want to go back there. That's what the statistics say. They want to look at something better. So I'm going to follow up on an invitation that was, I heard, given at the last webinar, to collect these stories. You all are writing history today. So how wonderful it would be if everybody on this call wrote a little bit of their narrative of what they are experiencing, and what silver linings have they experienced, and what are they hoping for, and what have they done to overcome. You will create a resource list for the next hopefully never, but for resiliency. So I'm going to leave it there and hand it over to the next person who wants to speak.
Thank you, Dr. Panda. Do we have anyone else to share their experience regarding this issue? I would like to, confess on behalf of the earth, everyone on the earth, that we are not learning anything about a critical situation unless we face that situation. So we do not have any idea about how to face an earthquake unless we, be in an earthquake and we see that, okay, we do not have any idea that what I should do right now. So we start thinking about, okay, for the next earthquake, what I should do, and we start to learn. And the fact is that, as Dr. Panda said, this knowledge, these learnings are achieved during these experiences. We are, learning by living, we are learning by experiencing. And I'm glad that this is a concern for everyone, that, okay, for the next pandemic, what should we do? And we know that, for example, this webinar is organized by InciSioN and Students for COVID. And InciSioN is working on global surgery. We all know that every day, all surgeons all around the world are, saying that, okay, we do not have enough instruments, we do not have enough, for example, ventilators or surgical masks. And everything that we need during this pandemic is kind of, surgical instruments. They are kind of, instruments that we already are in shortage of them. In the normal situation, we're in shortage of ventilators. And just see that just see the situation when we need more number of this kind of instruments. So I'm so glad that everyone are thinking about this issue. And I hope that at least at this moment, we start to solve these problems for the next crisis. I hope not to have any crisis anymore, but crisis is part of nature. We should be ready for any crisis in the future. I think we have only one more question to ask. I'm sorry, I'm a very talkative person. I talk a lot. We have another question to ask. I think the last one. It is, the level of activities differ significantly for students in towns and rural areas, with rural communities more active during the pandemic period. And do you think it's possible to compare mental health issues between these areas, means rural and town areas? Do you have any experience, about yourself, your own experiences, your friends? We know that all of us in the universities, we have several friends and colleagues from different regions and areas of the country and world, and you may have some experiences from them. Do you have any experience to share?
I mean, this isn't a perspective from the UK version, but I know in India, there are students who live in rural communities whose real income wage is as laborers, i.e. they're people who usually go in day to day and work, etc., etc. And there are people who live in urban communities whose day-to-day wages are likely to be intact regardless of whatever happens during the pandemic, because they're likely to work from home. So there are added stresses in possibly rural houses in these situations, because they do not have any financial backbone backing at all, and that can be an issue. And I think there is an onus on individuals across the world here to have this community spirit, to look out for one another, as has been mentioned before. For example, if individuals are still able to go to work and they previously had people working for them, then there is an onus on them to keep those financial lifelines alive as well, as a kind of a stream from one person to another. And this might not apply to anyone on this chat, given we're all medical students on this chat. But I think it's really important that we also realize that this is a real life situation, and that if you are going to become a doctor in these countries, these are going to be your patients. And as one person once said to me when a patient came in with a deficiency, the only true medicine for nutritional deficiency is by giving them fruits and vegetables. And it's just simple things like this that are lacking, the supply chains that are lacking can be easily dealt with by those who are more fortunate, just going out and helping the community and making sure those less fortunate get the nutrition they need, get the food they need, get the financial help that they need, if we are so able to provide it.
And I would add, and I think this is sort of a more general response to the question. I think one of the things that we're seeing absolutely is that the pandemic, and particularly around mental health, is going to hit different communities differently and different people at different times, right? So I think it's Bruce Swartz, who's the head of the American Psychiatric Association, for example, says, today's healthcare providers are tomorrow's patients. And what he means by that is right now we have so many healthcare workers who are doing fantastic work and working monstrous hours, and sort of filing away the experiences, and at some point we'll need to address those experiences. So once this pandemic is over, that wave of mental health needs will likely hit sort of after the physical aspect. So I do think that there's differences between communities, and I think it's going to hit just very differently and at various times. And so that's going to be a sort of a big challenge, because I think there will be a spot where people may think, oh, this is over, but then sort of the mental health crisis will really hit and really settle in.
I think I just want to add on to that, because you said it very well, that it is a very humbling notion to think about that. And I think creating awareness as we are in communities like this, but also I think it was Aliyu who said advocacy. What can we do to advocate, to start creating this culture of well-being? And I love the best definition of service. How do you serve? You serve with what is in your hands, right? Each one of us have only that much in our hands. I always used to think, oh my God, I don't have the power. I don't have this to do things. But what can I do today to make a difference with whatever I have in my hands? And I think if we all start thinking like that, slowly we can create a culture of well-being. And culture, to me, changes only at the speed of trust. So how do we build this little trust within our community like this? And even if InciSioN, which is doing amazing work, and Students for COVID, what you all did with the global unity, the Hippocratic Oath, has already created ripples all over what you're doing today. So I think thinking about these little nuggets of well-being that you will create in your realm of influence, I think will have a ripple effect. Because it is very humbling to think about what will happen if we don't do it. And I don't think we have that permission today.
Thank you very much for your great words. And I don't know what to say more than whatever you have said. Everything that you said are truths that we may forget in difficult times, and we need people, we need friends, and we need experts and seniors and specialists to remind us those truths. I remember a year that WHO motto was "Let's talk." We cannot have a big group discussion with our attendees right now. It's not feasible due to the high number of attendance. But I would like to ask a question again, as similar as the question I asked in the beginning of the session. We heard your feelings in the beginning of the session and how you've been feeling during this pandemics and these weeks. So I would like to ask you again, how do you feel right now after this amazing session? There's no problem if you say, okay, I'm overwhelmed again. Yes, there's no problem to say, you know, I'm tired. There's no problem. Just be honest and say how you feel right now after this meeting, and even how, what do you want to do with your, you know, mental health, you know, in the future. So the chat room is yours, is open for everyone, and please send your feelings right now. And I again ask you to choose all panelists and attendees, because I see that everyone is sending their messages to you know, only panelists. So write, how do you feel in 2 words right now? This invitation is for, you know, everyone, also our panelists. So our dear panelists, please write your feelings too. I can see that you're not typing because your cameras is on. I see that most of us are hopeful, and that's a great, you know, even for all of us to be hopeful to the future. And there are either, you know, there are also interesting responses. Antonio is bored. Why she sent a common unit. That's a, you know, great. That was a great quote from Dr. Panda. I was surprised by that definition. I feel heard. That was interesting. Light and thankful. Oh, that was Catherine. I know that, I'm sure that you all know Catherine. Catherine is the co-chair of InciSioN Global. And also, I think she can talk right now, I think so. Catherine, I know that you're able to give a word. I would like to invite you to have a word at the, you know, end of the meeting. I know you were not supposed. I'm sorry to invite you immediately and before, without any before. You know.
These are weekly surprises. Hello, everyone. I get weekly surprises. I'm just here as a backup for in case internet drops, or for our wonderful moderator, Ahmadreza. But I seem to be getting weekly surprises. I should always remain dressed up and ready, I guess. But thank you so much for an incredible panel to everyone. I really appreciated it. I really enjoyed hearing everyone's thoughts and views. The quotes I'm taking away are the community one, and you know, the one that Vaishi shared. Takes a lot to live through history. And you know, I learned a lot. I feel much lighter. I recently experienced a loss in my family, and it's very difficult when it's during pandemic and you can't grieve. And so hearing about the grief process, hearing about issues the students are feeling all around the world, the insights from all of you was so incredible. I'm so thankful that we had this session. From the chat, what I saw that I really love is I saw Khair said that he felt heard, and that's the point of our webinars. And I'm really glad we are able to have this medium, to have these conversations. Again, I'm thankful to everyone who came in today as attendees, as panelists and speakers, and this is an amazing session. I hope that we can continue having these webinars and be there to support each other, because we really need that community right now.
Thank you very much.
Yeah, I think I'm going to echo with what Dr. Ostrander said earlier, you know, thank you for showing up. Thank you for speaking. Thank you for being brave. I just want to offer my deep gratitude to each of the panelists and everybody who asked the questions. Whether you realize it or not, each of you are making valuable difference. And I am so happy to see that. So thank you. And thank you for the organizers. You're doing an amazing job with this. This is what is needed.
Yes, thank you, everyone. And I've learned a lot. I've been taking messages and posting to Twitter and saving little quotes here and there. So I'm very grateful for being part of this today.
Thank you, everyone. Special thanks to Dr. Panda and Dr. Ostrander, and special thanks to our great panelists. I would like to thank everyone and appreciate our great panelists and our kind attendees. I would like to say goodbye by saying that that famous quote a few years ago, let's talk in this pandemic, during this situation, we should talk with each other. So let's talk with each other, and I'm going to say goodbye to all you our dear panelists. The floor is yours for saying goodbye.
Thank you, everyone.
Thank you, everyone. Bye.
Bye.
Thank you. Have a great time, everyone.
Thank you, everyone. Bye.